Welcome to our comprehensive guide on life-saving emergency skills. In this video, we'll walk you through essential techniques, including assessing vital signs, using the AVPU scale for consciousness, performing pulse checks, and controlling bleeding. Whether you're new to first aid or looking to sharpen your skills, you're in the right place. Let's dive into it and ensure you're always prepared when every second counts. Before we begin, don't forget to get your copy of our comprehensive guide, which covers all emergency situations and how to deal with them in isolated and wilderness environments. Link to purchase in the description below. Now let's get started with the explanation.
Welcome back. In the last video, we covered the ABCDEs of patient assessment. Now we can move on to vital signs and their acronym, AVPU. The first thing we check is the patient's heart rate. You can either feel the pulse at the wrist or in the neck. Use your index finger and your middle finger to palpate or feel for the patient's pulse. Then monitor for 60 seconds and count the number of heartbeats. A normal heartbeat will be between 60 and 100 beats a minute. Pause for a minute and try this on yourself. Feel your neck or your radial artery. Use the tip of your index finger and the third fingers of your other hand to feel the pulse in your radial artery between your wrist bone and the tendon on the thumb side of your wrist, and see if you can tell what your heartbeat is right now. The second thing we want to check is the respiratory rate. This means we want to know how many times a minute the patient is breathing. In order to identify this, we can look at the patient's chest and see how many times their chest rises and falls in a minute. Each rise and fall is one breath. Normally, a patient will be breathing about 12 to 20 times a minute. Rates lower or higher than this are concerning. The last thing we want to check is the patient's mental status. Again, we have an acronym for this to help you remember. The acronym that we use for this is AVPU, A-V-P-U. A stands for awake and alert. This means a patient is able to respond to you easily. When you ask a patient, "How are you doing?" they're able to respond to you and talk to you in a normal voice. V stands for verbal, and this means the patient responds to a verbal stimulus. They are not spontaneously talking. Their eyes generally are not open. The classic example of someone who's V is someone who's been drinking too much alcohol. They're sitting slumped over with their eyes closed. P stands for pain. This is a patient who does not respond to when you yell or call out their name. However, when you induce pain, the patient responds. A common way to do this is by pressing on the nail bed or base of the fingernail and seeing if the patient responds or draws back from the pain. Finally, U stands for unresponsive. This indicates a patient who is not responsive to any stimulus of any kind. The actions you take in each of these circumstances will vary depending upon the patient's status. Now that we have assessed the patient's vital signs and mental status, we will continue with a secondary, more detailed assessment once we've addressed any immediate life-threatening issues.
Hi, I'm going to teach you how to find a radial pulse. You're going to take your patient's hand in yours, at the end of the wrist, at the base of the thumb, on the side of the wrist, take your first two fingers. You will feel the heartbeat. We want you to count 30 seconds of beats. Multiply by 2, that gives you your patient's heart rate. Next, we want to teach you how to take a carotid pulse. At the angle where the jaw meets the neck, place your first two fingers. Slide your fingers slightly forward about 2 centimeters and feel for the pulse. If you cannot feel it, try moving around a little bit. Once you find it, count the number of beats for 30 seconds. Multiply by 2, and that will give you the heart rate. Keep in mind, you never want to feel for both carotid pulses at the same time.
Direct pressure for external bleeding. A wound that is bleeding heavily may not stop bleeding on its own. Applying direct pressure with a clean dressing, such as gauze, can help to slow or stop the bleeding. Ask for help. Use personal protective equipment. Wear gloves and eye protection, and if needed, a gown and mask. Gather supplies. Clean gauze, bandages, and tape or plaster. Use gauze or another clean, non-adherent dressing. Apply firm pressure with 2 or 3 fingers directly to the area that is bleeding. If the first dressing becomes soaked with blood, add another dressing. Do not remove the first dressing, as this will dislodge any clots that have formed. Apply firm pressure. Do not use bulky dressings. They can make it difficult to put enough pressure in the right place. If the wound is on a limb, elevate the limb above the heart. When bleeding stops, apply a bandage to keep the gauze in place. Use a pressure dressing if bleeding does not stop with direct pressure. Keep the wound covered with gauze. Assess pulses, motor and sensory function, and capillary refill before applying a pressure dressing. Firmly wrap the wound with a bandage. Assess pulses, motor and sensory function, and capillary refill after applying the pressure dressing. The pressure dressing should be firm, but not too tight. A dressing that is too tight can cause damage to tissues. Frequently reassess bleeding. If bleeding does not stop, consider a tourniquet.